Hey everyone, welcome back to Dietitians and Nutrition Support. As nutrition support providers, of course, we know that all of our time and effort is always going towards providing the best possible outcomes for our patients. And if we're hoping to strive towards the best possible outcomes, we also need to know how to provide that kind of quality care. So sometimes the best way to do that is actually talking straight to the patient, hearing from them and hearing about what they want and what they need and their goals for nutrition support. So to talk you a little bit through the patient perspective today is Swapna Kakani. She is a long-term enteral and parenteral nutrition patient who has a whole bunch of different insights as to how you can become the most curious provider possible and keep providing awesome care for all of your patients.
Hi, my name is Swapna Kakani, and I am a professional speaker and healthcare advocate in both the short bowel syndrome, larger intestinal disorder, and rare disease space. The odds were against me the day I was born. I was born 30 years ago in 1989 with a birth defect of the small intestine called multiple intestinal atresias. When I was born, I was immediately rushed to the nearest children's hospital in Alabama, where I had my first abdominal surgery at day 2 of life. And it was then where my parents and the surgeon found out that the result was extensive. And I was not born with all of my small intestine, but the remaining intestine was anatomically and physiologically inadequate. I had a lot of dilated loops. Day 2 of life, I also received a central line and in my chest and a feeding tube in my stomach, a gastrostomy tube, where I became dependent on both TPN and enteral nutrition. The surgeon said the prognosis is unknown and we were to take each day one at a time. As a family, we could easily have said, this is the end. This diagnosis is the end. However, we said, no, we're going to keep on living, this time one day at a time, and appreciating each milestone I'm able to achieve and our family is able to reach. And being cognizant of the mental fortitude, the stamina, the perseverance that's required to reach these milestones with short bowel syndrome. This was our new normal. From day 2 of life to today, I have been dependent or received partial TPN anywhere from 3 nights a week to 7 nights a week for 27 years and counting. Only from the age of 3 to 6 have I not received TPN, but I did not grow or gain weight. I also received enteral nutrition through the gastrostomy tube for my first 20 years of life, 16 hours every day. I went to school just like my peers, and I went to school with 2 backpacks, my academic backpack and my nutritional backpack. And I was determined to do anything and everything just like my peers, but this time with my backpack on. My backpack, my IVs, my tube, they're a part of me, but they didn't define me. They were a driving force to move forward. I really thought that one day I'm going to be just like my peers. I'm going to leap into the world of the healthy, thinking there was this drastic difference. And I will not have IVs and tubes. It took until the age of 17 to understand the chronic short bowel syndrome and chronic TPN. I participated in extracurricular activities, academics to the highest ability, played tennis, all with my backpack on. We made modifications on the tennis team so that I wouldn't push myself too much physically or be at the risk of dehydration. In my 30 years, I've had 31 central lines. Of the 31 central lines, I've had 25 bacterial or fungal infections, but my proudest number is it has been 13 years since my last central line infection. And it has been 4 years just with this current central line, which is the longest I've ever had a central line. I can share those numbers with you and share this story and live the life I'm living today because of curious providers. Providers that can think outside the box, that don't settle for the status quo. My case was, is, and will be complicated. I need providers that can commit to that complexity, but also curious means valuing the patient, understanding my story, the good, the bad, the ugly, my good and bad habits, my short-term and long-term goals. It was those curious providers my family and I worked very hard to surround ourselves with. And it's these curious providers that I feel strongly have influenced my positive outcomes today. After finishing high school and entering college, we noticed quickly that I was continuing to have the abdominal symptoms that I struggled with for most of childhood, and that the anatomy and physiology of my gut was limiting me in my ability to push more enteral nutrition as well as oral nutrition. Growing up, I ate just for taste. Most, or if not all, my calories came from either the TPN or the enteral nutrition. We decided to have one more surgery in hopes that this surgery would give us the goal of at least no more TPN and at least possibly enteral autonomy. Unfortunately, the surgery resulted in complications that resulted in more surgery, more complications, and more surgery. I had 14 surgeries over 2 years. The complications were fistulas. I had fistulas between my small intestine, large intestine, skin, which were all also connected to my bladder. I was urinating food and bile, and the same food and bile would drain spontaneously onto my skin. I was raw, both physically and mentally. I had to stop college, I had to move back home with my parents, and I was bedridden. I lived my life vicariously through my peers, but so disappointed that I could not continue what's typical for a 20-something-year-old. I was in pain, and I could not relate to anyone else with these symptoms. My family and I put my health in our hands, and we traveled across the country seeking subspecialist after subspecialist. Because my parents, myself, we were hopeful that I would defy the odds just one more time. We decided through multiple visits with doctors that I made the decision to have the small intestine removed after fighting for it for the previous 24 years. Removing the small intestine would guarantee the removal of the fistulas, but it also guaranteed the dependency of IV and TPN. I was now on TPN and IV 24/7. The G-tube was to gravity drainage 24/7. I wore a leg bag during the day, and I could not eat solid food. I was only limited to clear liquids, which drained immediately into the bag. With that quality of life, however, and no more fistulas, I went back to college and graduated. I knew that I didn't want to live that lifestyle for the long run, and I wanted to move forward despite the possible risk. I made another difficult decision to have a small intestine organ transplant. I was listed on June 3rd, 2014, and just 15 days later, I received a small intestine. Since the transplant, I've reached goals I've only dreamed of since I was born. I now have a full functioning small intestine. I no longer have a feeding tube or a gastrostomy tube. I can eat to my heart's desire. I no longer have pain before, during, or after eating, something I was very accustomed to growing up. I no longer have to vent my G-tube. And I'm finishing more plates than I ever have. I've increased my capacity to eat and the selection of food that I eat. But with highs, there have been lows. I thought I would leave and walk away from TPN and IV nutrition, but it's rather different. I achieved the goal of no more IVs and tubes about 1 year after the transplant, but 6 months later, I lost 30 pounds and got severely dehydrated, requiring the need of IV nutrition. And I have been back on TPN ever since. I've also acquired avascular necrosis of both the hips and shoulders and had bilateral hip replacements at the age of 26. 65 surgeries in my 30 years have taught me simple truths that I want to share with you. Number one, my goal is to live, not to survive. Oftentimes we look at nuanced details to make sure the patient has the health to survive, and that is very important. Those are extremely important in crisis moments. But what about the long term? And how are we able to live with the nutrition support we have? And what is the quality of life or that we can create for ourselves? I am grateful to be alive today. And there are moments where it's been miraculous that I survived. But that is not the whole story. And we have to value what it takes to live. Oftentimes, these two, health and life, are looked at separately, health versus life. I see it as health and life. And this is number two. I've personally experienced life without health and health without life. It's very hard and rare to have both, but I'm confident that with curious providers and an empowered patient, you can have both. There's a picture where a provider is talking to a patient on TPN and says, "You look good, your numbers look good, your labs look good, you're good, you can go." And the patient is thinking, "I'm not good. I don't sleep at night. I'm urinating frequently. I can't carry my backpack when the TPN bag is full, so it makes me dependent on the pole. I'm not able to work." The additional concerns that can cause anxiety living on TPN are real, and that is what impacts our life. And we can work together to make changes or improvements on the health side to create life and vice versa. It's health and life. Number three, every person has a story that adds value to their care. It is up to us to listen to it. It was really important for the patient's story, their etiology, to be an equal team member or to be respected in clinical decision making. And I know that not everyone is like myself, as informed, have the ability to articulate their needs or maybe even care. But I promise you, everyone has a story that has value to their care. I felt like I needed to find a team that understood number three, or valued my story and the goals that I have, possibly different from my clinical team. And so I went out to find the pit crew. I discharged myself from a nutrition team that was only looking at values rather than the larger life picture, and found the pit crew that now I have providers in multiple states that make up my nutrition support team. These are some members of an effective pit crew. But what a nutrition support team typically looks like for a lot of patients are physicians, pharmacists, dietitians, nurses. And even that can be hard to surround yourself with and maintain. I didn't select mental health professionals or OT, PT because it's very rare that those are on the team. I have now spent the last 6 months trying to find a mental health professional because I feel like every other member of the pit crew has been filled except mental health professional. Health, unfortunately, is too rarely perceived as a group phenomenon, but the pit crew that I just shared is the core of that group with the patient. And nutrition support is a perfect field and a necessary field for multidisciplinary care. Number four, meet patients where they are. At the age of 10, I had an endocrinologist, and the first appointment, he walked into the room and my dad and I were sitting in the chairs, and he came and sat immediately on the exam table, did not ask me to move, set my chart to the side, never opened it, and looked straight into my eyes, not my dad's, and said, "Swapna, what is your goal? How can I help you?" That is the first time and only time a provider has asked me, what is my goal? But he was trying to meet me where I was, even at the age of 10, because he knew this was going to be a long-term relationship. He was making the investment. I didn't know what the goal was then, but I now know my goals. And I articulate that goals to my teams. Meet patients where they are to help them create their own goals that both providers and patients are happy with, that address both health and life. That requires communication from both sides. One part of communication is being very transparent about treatments. When the formula of TPN and lipids advanced in the last couple of years, my pharmacist called me out of the blue, called me and told me what formula, what lipid formula they are changing my TPN to. And she told me the medical reasons of why, but I will never forget that phone call and her desire to communicate that change to me. And so for her to call me, I trusted her. I trusted her communication. And because of that, I could communicate to nurses about line care. I could communicate to dietitians, I want you to help me in this way. And I will tell you, dietitians have helped me in areas of my health that you would not typically think of for a dietitian, but because they know me, they knew me. And when I needed another provider's opinion, they were able to give it. The fifth simple truth is, what is your goal? I shared the story of the endocrinologist and when I was a kid, being the first provider to ever ask me, what is your goal? And I now encourage others to ask patients both in the hospital, out of the hospital, in the home setting, what is your goal? The communication between my current dietitian and myself, I tell her my goals, she tells me her goals for me, and we come to a happy middle. Lastly, please use the 5 simple truths I've shared to help empower the patients alongside yourselves as providers. We are part of the solution. This quote, I think, represents the value and power of dietitians for individuals on nutrition support. I would not be here working, enjoying life, if I was not willing to advocate for myself, get in trouble with my teams, and find the one person in the nutrition world who would be my champion. Thank you.